Hi, my name is Dr. Scott. I'm here to educate you today on fish oil. A lot of people are taking it or they hear about it, but they don't know what the benefits are. Why are they taking it? How much do they take? What's the best source of fish oil, and what type of fish oil is the best to consume? So that's what I'm here to talk to you about today. I am a doctor of chiropractic and a certified nutritionist. And I've been in practice for 14 years, and my passion is to educate and help the world into a lifestyle of wellness. And given that, there are some supplements that I always like to recommend patients, and one of my top ones is a fish oil supplement, mainly due to the fact that a lot of the country doesn't ingest the right foods or enough of the right foods to be able to get the nutrients that fish oil offers. And what that nutrient is omega-3 fatty acids. Fatty acids are essential for the body. They're known as EFAs, and that stands for essential fatty acids. The body needs them to sustain our health and our life even. And there's different types of essential fatty acids. Those are omega-3s, omega-6s, and omega-9s. We get plenty of omega-6s and plenty of omega-9s just in our food out there. Unfortunately, omega-3s are a little harder to get. Number one, because the main source of those is fish. Some people don't eat fish. They don't like fish. If you do like fish, it's not safe to eat a lot of fish because of the toxicity load that is in our fish today. Other sources such as seeds and nuts, people will eat, but sometimes we're just not getting enough of that. And it's a great balance to have a ratio of about a 2-to-1 or 4-to-1 ratio with the omega-3 versus the omega-6. Omega-6s you can find in everything. That is one reason why I recommend you to stay away from a supplement that will have omegas 3, 6, and 9, because it's not necessary to have the 6s and 9s. We just get enough of those, and too much of those can actually go against your health. So we want to load you up with good quality omega-3 fatty acids. Those fatty acids are called EPA and DHA. They're very long names, so we'll just shorten it and call them EPA and DHA. And when you go and you go to purchase a fish oil product, whether online or in the nutrition store, you're going to see that the label will talk about EFA and DHA and how much of it is in it. So in regards to dosage, that's what you're looking for. You're looking for something that has a good amount of EFA and DHA, because that is what you're looking for to get out of a fish oil supplement that benefits our health. Health benefits for fish oil or omega-3 fatty acids there's a lot of them. It's great for brain health and cardiovascular health, immune health, joint health, gut function. It's good for hair and nails, anti-inflammation. So you can see the benefits of omega-3 fatty acids are numerous. Omega-3 fatty acids are known to deflame tissue, to deflame the body. Omega-6 fatty acids do the opposite. They're called pro-inflammatory. So we have anti-inflammatory fatty acids, which are omega-3, and pro-inflammatory fatty acids, which are omega-6s. We need both of them. We need both to sustain our health. But if you have an inflammatory condition, let's just say, which are cancer and heart disease and stroke and diabetes and respiratory issues, autoimmune disorders, and you are considered an inflamed person, or obesity even, the last thing you want to do is load up on a lot of omega-6 fatty acids. You want to get more of the omega-3s to help deflame your tissues and deflame the body. So that's why a diet that's rich in omega-3s and lower in omega-6s is going to be a great diet, along with an omega-3 supplement to make sure you're really getting those fatty acids into your body to help you sustain your health and go on the path of wellness. As far as the dosage goes, if you're getting a strong dose of anywhere from 1,000 to 1,500 milligrams of a combined EPA and DHA, that's plenty. Your body is not going to absorb much more than that at one time. Some of my patients, I may prescribe them to do a dose of about 1,300 milligrams once, twice, or even 3 times a day, but that will be spread out, because if you overdo it, a lot of products are giving you 2,000, 2,500 at one dose. you're just wasting. Your body's just going to rid the excess. So next, let's talk about what is the best source of fish oil. There's a lot of them out there. You're going to see on labels salmon, herring, mackerel. You'll see sardine, anchovy. The smaller fish, the sardines and the anchovy, are basically more optimal. Number one is because they have the highest amount of EPA and DHA in their oil. Number two, they have the lowest amount of toxicity. All fish have a degree of toxicity with mercury, other heavy metals, dioxins, PCBs. These are the things that humans, if we ingest those, our body needs to rid those toxins, and sometimes they don't. So they can accumulate in the tissues and cause a lot of health issues, down the line. So when a fish oil manufacturer processes the fish oil, it has to be put through a detoxification process. So you want to look for a fish oil that's been through molecular distillation, which removes 99.9% of all these toxins. That's very, very important, because if you just go and eat fish every day, yeah, you're going to get a good absorption, and it is the best way to absorb fatty acids, is just eating fish, but you're also going to get those toxins. So you can get a highly concentrated amount of omega-3 fatty acids in a fish oil supplement without the toxins by getting a fish oil supplement. When it comes to the type of fish oil, a lot of people aren't aware of. There's basically two types out on the market. One of them is advertised, the one is just basically because 90% of them are this type, and that's called an EE form, ethyl ester form. The other 10% is called triglyceride form. And I don't want you to get this mixed up with, you think high triglycerides, you run from it. That's not what this is referring to. A good triglyceride form fish oil actually lowers your triglycerides that we get so associated with high cholesterol and diabetes. The difference here is when a manufacturer takes the fish and needs to molecularly distill, or they need to cleanse the fish oil through whatever process they're going to use, the first thing that needs to be done is that fish oil needs to be brought into what's called the ethyl ester form, okay, in order for it to be cleansed, okay, or detoxified. A lot of manufacturers, once they do that, they just leave it in that form. They don't bother bringing it back to the original natural form, which is the triglyceride form. So you always want to make sure that you're looking for a triglyceride form, because number one, it's an easier way to absorb those omega-3s. When you take it in the EE form, or the ethyl ester form, your body has to make an extra step, because your body will not move those fatty acids around in the ethyl ester form. It needs to be converted to the triglyceride form first. So the absorption of that hinders because of this process. And the main thing about this is when the body takes it from the EE form to the TG form, or triglyceride form, ethanol is going to be released if you ingest it as an ethyl ester form. And ethanol can cause side effects. It could cause, some people are very sensitive to the ethanol, and they can have side effects like burping and rashes, and actually get achy back pain and joint pain, and sometimes that's just from the ethanol. So I always recommend looking for a form of fish oil that is triglyceride form, and it'll state this for you on the label. If it doesn't state that on the label, then you're dealing with an ethyl ester form. Okay, so given that, let's recap. So you want to find a fish oil supplement that has a good substantial amount of EPA and DHA, because that's the thing that you're looking for where you get the health benefits from. Anywhere from 1,000 to 1,500 milligrams per serving is going to be a good dose for a patient to consume. Next, you want to look for a source that is basically salmon, anchovy, sardine. I prefer anchovy. That's noted to be probably the best source of fish oil you can get, would be the anchovy, due to the fact that it's got the lowest amount of toxicity and it's got the highest yield of the EPA and the DHA fatty acids. And then lastly, you want to look for a fish oil that's in the triglyceride form. I personally have designed my own fish oil product that is on the market, and you can purchase it through Amazon. It's strictly sold on Amazon, and I got a bottle right here. It is Dr. Scott's formula. It is a triglyceride form. It's called the Hypo Omega 3. It's got 1,300 milligrams of combined fish oils, omega-3 fatty acids in the form of EPA and DHA. It's molecularly distilled. It's also pharmaceutical grade, and it's third-party tested. That's one more thing I like to add is third-party testing. GMP certification, IFOS certification, ISO 9001 certifications. These are third parties that come in and make sure that there's a quality and the quantity is right in these products that you're buying. GMP certification and ISO 9001 are two that are for Dr. Scott's formulas. So I would love for you to try this and reap the health benefits. Again, this is Dr. Scott, and I thank you very much for your time.